Welcome to Life, Death, and the Space Between. When I originally received the request for today's podcast guest, I figured we'd be talking about death and how to approach your life more consciously, because today's guest, Dr. Katie Deming, is a conscious oncologist. That's what she calls herself. And I thought, okay, so we'll talk about how we're more conscious in our lives, how that perhaps helps prevent cancer and other illnesses from manifesting in our body. But the conversation took a whole different turn. And part of the reason it took that different turn was because the week before I was on her podcast and she opened up and shared with me something that she shares very judiciously. And it does have the possibility of really changing the trajectory of how she practices. So I think you all will love to hear this perspective from a traditionally trained medical Western doctor and how she is incorporating her psychic abilities in her practice. So with that, here is today's episode of Life, Death, and the Space Between. Welcome, Dr. Katie Deming.
Thank you so much, Amy. It's so nice to be here.
So you and I spoke last week, I think it was. We had a little podcast swap. But first, let's talk a little bit about what it means to be a conscious oncologist.
Sure. So my practice is the closest thing that I would describe it to as an integrative practice. So an integrative or holistic approach to treating cancer. And my experience is I spent 20 years in Western medicine as a radiation oncologist and as a healthcare leader. And then I had a metaphysical experience we'll probably talk about that basically made me see that what we were doing in Western medicine was broken and that model was not true healing. It wasn't actually making people well. It was treating the symptoms. And so it took me several years, but I ended up leaving Western medicine and created a practice. But the practice that I've created, I call my practice conscious oncology or conscious medicine. And the idea is that really healing requires a holistic approach, which is physical healing, emotional healing, mental and spiritual healing all together. And you could open just an integrative practice and just focus on one of those areas. And one of the things that has become very clear for me is that you can't just do a couple of these or one of these. You have to really focus on the whole picture. And so for me, conscious oncology is really bringing in all of those pieces in a robust way to help bring wholeness back to the person, because healing actually, by definition, means bringing wholeness back. And so that is my practice. My practice is really a holistic approach to healing cancer.
So in your and my conversation, we were talking about death, and you obviously deal with death pretty frequently. Working with people with cancer, I'm sure many of them don't survive. What has happened, or what sort of interesting spiritual experiences have you had that have happened that have kind of shifted how you understand death and dying?
Sure. Well, actually, my whole career, death has been this pull through that's come through basically from the very beginning. When I was looking at applying to medical school, I was a neuroscience and biopsychology major in undergrad. And I thought, okay, I could either do research with this or I could go to medical school. And my mom really discouraged me from going to medical school because she was a nurse practitioner and she worked with a lot of doctors. And she's like, I just don't know that you want to do that. And ultimately I was like, well, what would be the one thing that I would couldn't handle about medicine? And I thought that death was that thing, because I'd only had one experience with death. When I was in fourth grade, one of my friends died of leukemia. And that was scary, actually, as a child. And so I just was like, death is something I don't want to deal with. So I think if I go volunteer at hospice, then I can just cross medicine off my list. So when I was 20 years old, I went and volunteered at hospice. And as you can see, the story did not turn out the way that I thought it would. And it changed my life because being around people who were facing the end of their life was very profound for me. And the things that they shared with me were things that I hadn't heard from the people in my life. I hadn't heard from my parents or my teachers or my coaches or the people who had been mentors to me had not had the same reflections as these people who were facing the end of their life. And they all said consistent things like, I wish I had been true to myself. I wish I'd listened to that little voice inside. I wish I had, been who I knew I was. I just was afraid to be it. And like just these consistent messages about what they would have done differently looking back at their life. And I was kind of sold. I was like, I want to be with these people. And it wasn't the science. Like, it's not like I loved the science of oncology, but most of the patients who were in this hospice had either AIDS or cancer. And I was just somehow drawn to people with cancer. And I knew from there that I wanted to become a doctor, and specifically, I wanted to become an oncologist. So death has been really an advisor for me since the very beginning of my career. And I that's not an accident. I know that's not an accident or coincidence.
So you really went into the hospice space to prove to yourself that medicine was not going to be for you because of this fear of death.
Correct. Yeah. And then what I found was I loved the intimacy of being with people when they faced life-threatening illness or if cancer basically brings up all of the concerns about mortality, brings up our mortality, it brings up that fear of death. But I loved that space of being with people who had cancer, but I especially was good with people who are facing the end of their life. And so in my career, like as a radiation oncologist, a typical practice has about 40% of palliative work and 60% curative. So 40% of the people that I saw had disease that was considered incurable and would eventually die of their disease. And so I spent a lot of time around people who were facing the end of their life and coming close to death. And the thing that I found was I am very comfortable in that space. Like, it doesn't scare me. And there's such an intimacy that people really need someone who can be with them in that space and not be afraid, because otherwise if I was the provider, I'm projecting my fears onto them. It's just a space that I've always been very comfortable in. And so through my career, I've done things like spent more time around people who were dying and actually participated in medical aid in dying, which is legal in Oregon, which is where someone who has a terminal illness can choose to take medications to end their life on their terms instead of, letting the natural course of their disease, unfold and them having terrible pain or debilitation, that kind of thing. And so I've done that. And actually,
how does that, I want to stop you there because I don't want to derail the whole conversation to be about medical aid in dying, but I've never talked about that on the show. How does that usually play itself out in terms of what are the factors you look at in assisting someone?
Yeah, well, so they have to meet specific criteria. Like they need to be, I don't remember what all the criteria are, but let's say less than 6-month survival. They need to not have a psychiatric illness that might be clouding their ability to make the decision. There's like this whole screening process. You have to see multiple physicians who say that, yes, this person understands. They also have a terminal illness and they are of sound mind to make this decision. But then most doctors who participate in this, they basically prescribe the medications and then the patients take the medication. They have to take it themselves. So nobody can give it to them. Like a family member can't, they have to be able to sit up and to drink the fluid. Or I think there's some ways they can do it via other routes, but the person has to push it through. Like say they had a feeding tube, they have to actually push it through, that kind of thing. So anyway, most doctors don't participate, but for me, I decided when I would participate in this that I would actually offer to be there with my clients if they decided to take it. And so the normal process, patients take this with their family members, but in the way that I participated with, if they wanted me there, I would be there at bedside with them to make sure if they had any trouble getting it down, if they started vomiting, it can be scary because what if it doesn't go down? What if things don't go right? What if, you don't want to scare the family members who are present? And so, basically I was there with one of my patients, the first one who decided to use this medication. And that was actually the only one that I ever followed all the way through, because with this procedure, a lot of people just get everything in place so that they can take it if they need it. But the goal is to not necessarily have to take it. And that's the typical is like only like a third, I think, of the people who start the process actually take the medication. So that kind of fits with what I saw in my practice as well. I saw more people than actually ended up taking the medication.
Because as they get closer to it, they start to question whether or not that's something they really want to do, or they just die naturally.
Yeah, no, they just, it's different for everyone, but many people just want the option so that if they did become like, they had terrible pain or things became unbearable for them, that they had the option, but they don't necessarily want to necessarily take it. So some people just get it so they have it, so that it gives kind of a sense of control, during a scary time where they're just worried, what if I got into so much pain? I don't want to be in intractable pain and die in pain. I'd rather be able to take it. And so a lot of people get to the point where they're like, no, I'm comfortable, and they die naturally and don't actually use the medication. So, and I think that's kind of the best way to have it available for people so that they can, but then, not necessarily use it if they don't want to. And this particular patient who ended up using it, she was very clear how she wanted the end of her life to go. She was very tuned in. And so it made it easy, to help her through the process, but not everyone is that clear. People kind of, they're wanting to explore all their options. And that's one of the options that's available in my state.
Got it. Okay. That's really helpful. And it's not available through hospice, right? It's its own kind of evaluation process.
Yeah, it's totally actually separate from hospice. And this has been one of the, hard things, is because in many states, hospice doesn't participate because there's like this question of conflict of interest of like, if you're doing hospice well, why would you need to do, this, end it on your own terms. And so there's been this weird thing where sometimes hospice has to like leave if people are going to take the medication. And that's not good, because hospice is the people who are taking care of people at the end of life. So that you bring up a good point, and it's a sticking point that the different states are working through it in different ways.
Got it. Okay. So tell us what you've experienced with death.
Sure. Well, I think the first experience that really shifted me was with this particular patient that I did the medical aid in dying. And I helped her through her transition. And it was me, her daughter, and it was her daughter and myself. And it was beautiful death. Like, death can be such a beautiful experience. And this was one of those. This was truly a beautiful experience. And we held her.
What made it beautiful? Yeah, I'm curious, like leading up to the very end.
Yeah, like I think her clarity was really helpful for her family, because even though her family was scared, they knew this is like how she wanted things to happen. And then it's like the, medication went down okay. I was there to help make sure she got down what she needed. And then she was talking to me, and she actually, I forgot about this until just right now, but she grabbed my face right before she died. And she looked at me and she told me, she said, "I'm so proud of you for the work that you're doing. It's so important." And then she asked me if I saw the garden. And then she closed her eyes and she went to sleep. And I laid her down in the bed, and it was beautiful. It was just peaceful. And then her daughter came in the room And she had enough wherewithal to say, I don't want my daughter in the room when I take the medications, because she was worried if she vomited or she couldn't get it down, that if there was any struggle, she didn't want her daughter to see that. So she and I sat with her while she took the medication. I made sure everything went down. And then I brought her daughter in. And so everything that her daughter saw was not struggle, was not pain. It was beautiful. And I think that contributes to helping family members. Because, right, one of the things we hate to see is our loved ones struggling to breathe, or, vomiting, or any of those things. And so we sat with her, and her daughter told stories, while we waited for her to pass. And at one point, basically, I saw coming out of her, the patient, and basically going straight into her daughter's chest, like just energy, just leaving her body and going to her daughter's chest. And I asked her daughter, I said, did you feel that? And she said, oh my gosh, I feel her inside me now.
Oh my gosh, I have the goosebumps all over.
Yeah. And then her daughter was like took a big, deep breath. And then all of a sudden, the whole room was filled with whatever that energy was that had gone from her mom to her, and then basically filled the room. And she said, she's gone. And sure enough, she was gone, like within a minute or so. She was gone. And I remember leaving her house and having the very profound knowing that when we leave here, when we leave this body, we leave alone. And that whatever she was going to face, she was going to face alone. And for me, it was such a profound lesson, because I had been starting to question whether I was aligned in my work as a radiation oncologist. And I knew that when I died, that I was going to be responsible to myself. That my husband was the one who wasn't supportive of me leaving. And so I remember this thinking, like, I can't live my life for anyone else, because when I leave, I'm to be accountable to myself, and I can't point to someone else. They're not going with me. When we leave this life, we leave alone. And I wasn't scared. It's not like I was scared of what I was going to face, but I knew that I'd be accountable for how I lived my life. And so I had that knowing after that experience. It was really profound for me. But
more meaning, like, not necessarily the notion like we're completely alone, but more when we look at our lives, we alone are responsible for the choices that we've made. We can't look and say, you made me do this, you didn't let me do this. Exactly. But really, we hold that power. If you love the show, there are several ways you can show the love. You can go to patreon.com at Dr. Amy Robbins, just put in my name, and support the show in any monetary amount you feel comfortable. $5, $10, $20 a month makes the world of difference to me. So I would appreciate if you could support the show. If you're already supporting the show, there aren't enough ways to put into words how grateful I am for that support. It literally has made such a difference to me, and it is what keeps this show going. So thank you so much. Also, make sure you're subscribed anywhere you can get the show. You are following me on Instagram. Please subscribe to my newsletter, dramyrobbins.com, where I do bi-monthly soul wisdoms. I'm going to be getting back to that. I took a little break, but they are coming back. And also you can follow me on Instagram at Dr. Amy Robbins. That is where I'm the most active. That's the social media platform you can find me on the most frequently. And just reach out. Let me know your thoughts on a podcast. Share the podcast with friends, whomever you think would be interested in this topic. Just please pass it along. And thanks as always for your support.
That is exactly the sense. It's not that when we leave, we're alone. I'll talk about that in a second, but it was more when we finish this life and we reflect back on our journey through this lifetime, we're responsible for how we lived it and what we chose to do. So in 2020, I had an experience called a shared death experience. And I didn't even know that this was a thing, but most people know of a near-death experience. And
by the way, you've not shared this.
No. Well, so I've shared that I had the shared death experience on my podcast. So in this most recent, I just relaunched my podcast. And in this season, I explain this experience because this is what ultimately catapulted me to making the decision to leave. So I have shared that.
Okay.
I just haven't shared more than that.
Okay. So you're hearing it here first, people. Although by then they will have heard it on yours when I was on yours.
Well, not necessarily. So we can talk about that in a bit, because I don't know when that's going to come out. But basically what happened in 2020 was that I had an experience called a shared death experience. And basically this can most commonly happen to healthcare professionals or emergency personnel who are at the scene where someone dies. And those people who are not dying, but assisting the person who's dying, can have a metaphysical experience, much like a near-death experience, where they can feel the love and the light and the just overwhelming bliss of what people describe with a near-death experience. These people can have those same experiences and they can be life-changing. And so that happened to me.
And I think what's so powerful, sorry to stop you real quick, about a shared death experience versus a near-death experience is that people can sometimes dismiss a near-death experience as it's the release of DMT that causes that, versus if you're sharing in that, there is no chemical reaction that can be used as a reason for that.
Exactly. It's not some physiologic effect because I was conscious when it happened. That's exactly true. So basically, after that event, something shifted for me, and I knew I needed to leave Western medicine. Like I knew before that I had this sense, like I kept telling my husband, I'm like, I think I'm supposed to be doing something different. And he was like, that makes no sense. You've trained your whole life. You didn't finish training until you were 32. You have a great job. You care for people with cancer. You're good at it. What are you talking about? And I couldn't explain it. It didn't make logical sense. But after this event, I knew. I was like, I gotta leave. Like, this is not right. And I had this sense that not only that I wasn't doing what I was supposed to be doing, but that whatever we were doing in Western medicine was not right. Like, it wasn't the way that the body healed. And so it basically took me a couple of years to work through that process. And then you actually make the decision, because it resulted in a divorce and, moving through all of those changes to leave. But that shared death experience really was pivotal in shifting my, like, what I knew inside. It's almost like it broke it open. Like, I had this niggling, like, little voice that was telling me something was off, but all of a sudden it was just like, okay, broken open. And I couldn't deny it. And because of that experience in 2019, where I knew I was leaving alone, and from spending so much time around people who face the end of their life, I knew that I would regret it if I just stuffed this down and kept living my life just to make my husband happy and do what I was kind of quote unquote supposed to be doing. And I just blew up my life because I knew that my biggest fear is not of dying. My biggest fear is getting to the end of my life and realizing I didn't live the life that I was here to live.
Yep.
That's my biggest fear.
Perfectly. Yep. I'm with you.
Yeah.
So tell us about specifically what happened in this shared death experience.
Sure. So most of the time it happens when someone is physically at the scene, but my event did not happen in that way. So and I'm just going to give the whole story. I don't always give the whole story because sometimes people are like, what was happening? But basically I had joined into a coaching group the week that this happened. So I had just gotten into their community group, and it was like a transformational coaching program. And basically that same week, this woman who I know, who's a trauma therapist, so she does yoga, trauma therapy, and she was a traditionally trained therapist, and then was doing yoga therapy, and then had started doing kind of some drumming and shamanic ceremonies. And actually I had worked with her both to work through some trauma in the past, but then when I helped that patient die in 2019, we did a ceremony after she passed to honor the spirit. So after I left my patient's house, we went and did a ceremony just to honor that experience. And so I knew her from that. And anyway, so this same week that I had started this coaching program, or I guess maybe it might have been like she was reached out to me a couple weeks before, but she's like, okay, this is so weird. I feel really awkward even reaching out to you because you're a doctor and I'm a therapist. And this is like totally not something I would ever do with a client. But she said, Spirit keeps telling me that you have big power and that I'm supposed to help you. And she's like, and it won't stop. She said, it's like so relentless that I just like had to reach out to you. It's like, it sounds crazy, but she's like, this is just where we're at. So I was like, and I'm very open, even though I was like very much like just a 3D doctor. I was like, okay. I'm like, well, what does that mean? How are you supposed to help me? I'm like, what power do I have? I was like, I don't know. And she's like, I don't know. She's like, I don't know. The only thing that I'm seeing is that maybe we should come and just do a drumming ceremony. So I went and did a drumming ceremony with her, and there was no drugs involved. So no plant medicine, nothing. I've never done plant medicine, but she had me pick some things to put on the altar. And so I picked this large apophyllite stone. And basically we did the journey. During the journey, the things that I remember is like flying on an eagle and like, but I didn't really know what any of it meant. And so I had that event. I went home when I left, she said, the stone is wanting to go home with you. And like, this thing is like at least 25 pounds, this gigantic apophyllite stone. And I was like, wait, what are you talking about? The stone wants to come home with me? And she's like, yeah. And I was like, so you're suggesting I take it with me? Like, am I going to bring it back to you? She's like, yeah, you can borrow it, but it's telling me it wants to go with you. So I was like, okay.
You're like, and it's a stone. So how is it telling you it wants to go with me? Right?
Exactly. This is all like where I'm just like,
medical
okay.
Doctor.
I know.
Medical doctor.
Like, yeah. So, but like I said, I was open, even though I was like, I had never experienced any of this before. And I was like, okay. So I brought the stone home with me. That night when I got home, the stone called to me and told me to come meditate and put my hands on it.
This is a very verbal stone.
Yes. So basically I went down and I just started meditating with my hands on the stone. And within seconds, this woman came to me and she started talking and she said, I can't let go, but it's not because of me, it's because of them. And I instinctively knew that she was dying. And I knew that she was talking about her family or friends, that she couldn't leave them. And so I just told her, because I've been with so many people who have died, that I said, there's no rush. Like, you'll know when the time is right and I'll stay with you. And so then I just sat with her and I just meditated. And at some point I saw that this was a woman who I didn't know, but she was friends. She was the best friend of one of my colleagues that I worked with. And her name was Misty, this woman who was dying. Her name was Misty. And I had been helping my friend take care of Misty. So my friend was her best friend from childhood and was helping make sure her wishes were honored, that she could stay home through hospice. So I had been coaching my colleague and explaining, how to take care of her and make sure her wishes were honored so that she didn't have unnecessary treatments, that she could die at home and all of this stuff. And so I was entangled with her in this way. And basically, I knew that she was in her last few weeks of life, but I didn't know where she was at. So I saw that it was her at some point in the meditation. And then I was probably in meditation, maybe 30 to 40 minutes. I don't remember the exact time, but basically what happened is that at one point in the meditation, I started to feel her soul pulling away from the body. And then when there became like this tension, all of a sudden I heard these strings popping, like pop, 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 pop. And then it was like a release. And all of a sudden the whole sky above me just opened up and it was just love and light, the most beautiful light I've ever seen in my life. I've never experienced anything like it before in this lifetime. Mm-hmm. And she gasped and she was like, oh, it's so beautiful. I never had to worry. Mm-hmm. And then she was gone. And I was just in this space. And I was kind of freaked out because I was like, how did I get here? What just happened? But I knew that I had this sense of peace that I'm like, oh my gosh, whatever is past this life is like beautiful. Like the beauty and the peace and the love that just washed over me. And I have no idea how long I was in that space. And I also know that time doesn't exist in that space as well. So I don't even know that that's relevant, but I basically was in this space for some period of time and then came out and was like, what just happened? And I couldn't tell my husband because I knew my husband wouldn't understand. He'd be like, what are you doing, drugs or something? But I hadn't done any drugs. I hadn't been drinking. I was just like meditating. So I went to sleep. And when I woke up in the morning, I had a text on my phone and it was from my colleague and it was a photo of Misty and it said, Misty died. Thank you for all your help. Misty died last night. And I was just like,
little did your colleague know how much you actually helped.
Yeah. So I was like, oh my gosh, what do I say? And then I was like, I know this is a weird question, but what time did she die? And she died within minutes of when I had come out of that meditation. And so for me, that was confirmation. Like I know that I received that for a reason, to have confirmation that what I had experienced had actually happened. And then ultimately I was able to tell my friend, but it took me a little time because I was like, number one, I didn't want to hurt her, like with information that was, I didn't know how she was going to receive that. I didn't know if that would be helpful for her. But ultimately, in the end, it gave the family a lot of peace. And she even said, we couldn't figure out what happened that night because she was fighting. She didn't want to die. She was in her 30s and she didn't want to die. And then all of a sudden, I feel like it was a Sunday evening, but now I'm not remembering. But that evening, they said she all of a sudden became super peaceful. And they thought that someone from their family or someone who had passed before had come and helped her from the other side. And they were like, now we see it wasn't someone from the other side. It was you who gave her that peace and helped her through that last hurdle, because she just became very peaceful that evening. So that was my first experience. And it really changed so much for me.
Mm-hmm. And have these experiences continued for you since then?
Yeah. Well, what happened is that, it opened something for me in terms of my perceptions. So after that, I started to being able to access higher levels of consciousness and information, and would have, I guess, what people would call downloads, but just things would just like flow through me. And I didn't know where they were coming. And they were things that I had no way of knowing, but that I would just know. And so that started happening for me. And then I had a patient who was dying, who I was very close with. She had been my patient for like 16 years. And this was probably, so that experience I just described, the shared death experience, was like either late September, early October of 2020. And this was like in March or April of 2021. One of my patients was dying, and it was kind of happened unexpectedly and fast. And I was on vacation, and her husband, who knows me very well, was not happy with what was happening in the hospital. And I was the one doctor that he trusted. So he was texting me, and basically we're texting back and forth. And then I realized, like, oh, she's dying, but she's really fighting it. They have a young daughter, at the time was 9 years old. She was really young, did not want to die. And I was like, I wonder if I can help her. I wonder, like, I didn't know, I had no experience, like, intentionally doing this. That thing with Misty just happened, right? Like, I wasn't looking for it. I wasn't asking for it, but I was like, I don't even know. So then it was like a big leap, but I was like, okay, you have to make a decision. Either you're going to ask to see if you can help, or you're just going to step away. And it was, at the moment, it was really hard because it's such a weird thing to say, right? But so I told her husband, I said, I think that she's dying. And he said, absolutely, she's dying. And I said, I had this strange experience, and I think I might be able to help her. Would you want me to check on her on a soul level to see if I can help her make this transition? And he was like, whatever you need to do it. And so it was perfect. Of course, like, it didn't happen as an accident this way, but I was on vacation and I was in Ojai, California, which Ojai is like a very spiritual place. And so that's where I was on vacation by myself, which never happened. Like I was going there to do some work things, but ultimately just kept going in and out of meditation and checking in on this patient of mine. And in the beginning, she was like, it was weird. She was like a bee, like where she was almost like buzzing at me. Like I could tell she was like, get away. I'm not ready. I don't want to go. And so I was very respectful and just said, I just want you to know that I'm here and I'm here to assist you in whatever way that I can whenever you're ready. And there's no rush. There's no pressure. I am just here if you need me. And I kept checking in on her. And this was over several days. And then finally she was like, okay, I'm ready. And then that day I was like, oh God, well, now what do I do? Because I was like, okay, she's ready.
Right.
But
you're like, I can get her this far.
But I was like, okay, well, I was just then like, what do I do? And I happened to be getting a massage that day. And while I was getting the massage, Mother Teresa came in. And basically Mother Teresa told me, I'm going to show her. I'm going to show you how to walk her home. And I didn't know that that's a line that Mother Teresa uses, like that helping people die is called walking them home. But she basically took my hand and she took my hand and she told me to take my patient's hand. And she said, I'm going to show you and I'm going to walk her home with you so that the next time you can do it by yourself. And
it's so beautiful to hear the depth of your connection with your patients.
It's hard to talk about because it was so overwhelming. I was like, I didn't understand any of this at the time, that like guides will come in, to this space to help. And so I was like, wait, what? Mother Teresa? I was like, I was making it all about me. Like, what is this?
And not just a guide, Mother Teresa.
Yeah. So I was just confused and overwhelmed. But at the same time, I was like, okay, well, I'm just going to go with it. And afterwards, I looked up the things that Mother Teresa says and the things that she talks about when she helps people die. And the things that she showed me were things that I had never read about her before, but they were absolutely things that she talked about. And so that also was confirmation for me. But basically, it took like 2 days because this patient was just like, she was fighting it so hard. And so I would just show up. And then ultimately, it was for her, it was a hill. Basically, it looked like a green grassy knoll that she needed to walk up. And I knew she needed to walk up and I could only go so far. So we brought her as far as we could. And then at the top of the hill, there was this giant bear-like man and this tiny little woman standing at the top of the hill. And as soon as she saw him, my patient, she started running up to him and she ran into his arms and she said something like, oh my God, it's you, Daddy. And so I knew it was her dad. And this other woman, they just like took her by the hands and then they walked her over the hill. And I knew that was like, my job was done. And I asked her husband after the fact, I said, did her dad pass away before, is he already dead? And he said, yeah. And I said, do you mind showing me a picture? And I said, and also, does she have like a woman, like her grandma? Or I didn't get the sense that it was her mom, but there was another woman. And so sure enough, he showed me this picture of her dad. He was like 300 pounds, like 6'3", looked like a bear. And then this other woman, I think her name was Aunt Millie, who was basically like her mom, but it wasn't her mom, but she was, and it was her. And so I had seen both of them. And so that was the first time that I intentionally then used these gifts to help someone or help one of my own patients.
So how do you this is all really new for you. And when you and I were talking on your podcast, one of the things that I shared was what a beautiful ability this is, given the space that you're in. to be able to provide comfort beyond just the things that I think doctors say right at the end of life, or what they think they should say, or what other people say about it. And how do you see this perhaps opening up for you more? Because I think so many people have these experiences, particularly in the medical space. I have a lot of people reach out to me. In the therapeutic space, I have people reach out to me, but they don't share that or use it in any way.
Yeah, well, and I haven't either. It's funny. So for your listeners, this came out actually when I brought Dr. Amy onto my podcast, and I was thinking we were going to talk about death kind of as an advisor. And then ultimately I realized she was talking about how using intuitive gifts in her work has been so meaningful. And then also other people opening and acknowledging their gifts. And then I said, well, I guess I have something I have to say, but I wasn't really ready to say it to my audience then, although I realized everything happens for a reason. And so we recorded that episode. I haven't released it yet, but yes, this is all new for me. This is like the first time actually that when this episode airs, this will be the first time that I'm sharing this, in a public way. And I think that
that means so, it's so amazing how this has all kind of unfolded. Sort of the funniest part of this was that probably had I gone first, which was it was funny. Katie and I got on the podcast and she kind of looked at me like, are you ready to start? And I looked at her and I said, I think today you're interviewing me. But I think it does feel so serendipitous that it happened like that, because I think had I just kind of looked at your website, seen what you've done, this conversation would have gone a very different way. And maybe we would have gotten there. And I would hope that intuitively we would have gotten there, but it could have never come out.
Yeah. Yeah. And I think that there's absolutely value for me to use this, with people who are dealing with cancer or other conditions that are life-threatening, and having a doctor, someone who really understands the physical aspect of transitioning and dying, and also the spiritual aspect there's such a huge value there. And I think the hard part is that you feel like something's wrong with you. And I think that's part of why I feel like it's important that I say it, because what you're doing is to normalize it. I think that more of us are waking up now. Mm-hmm. And I think that me saying this is real, I didn't go looking for this. In fact, a lot of times I was like, why me? Why am I a medical doctor? Why did I go through all of this if I can do these things? But now I realize, no, this is part of it. Everything that's happened to me has happened to me in exactly the way that it's meant to, because part of what I can do is to normalize and to say, this is real. And there's value to it. And also, what a beautiful thing if more doctors, more professionals can open up to use intuitive gifts in their work. That's really important. And I received a message this weekend, which I don't, some people describe their guides or whatever. I don't have that. I don't have where I hear guides telling me things. I just all of a sudden see information. No. Yeah. Right. I just have a knowing. But I did have this weekend, I had an experience where the ancestors came to me, and I don't know what they mean by ancestors, but it wasn't my parents in this lifetime. It was ancient ancestors. And they came to me this weekend and they said, if you want to make the most impact, you need to start using your intuitive gifts. And I was so that happened on Saturday. And I was well, great. I'm I guess that's just in time for Amy's podcast. So
yeah. This is welcome. This is your coming out party. But I so empathize with you because that's where I was, so many years ago. And I was so afraid. And yet I felt like I was not fully myself without this part of myself. And I think it sounds like similarly, sometimes I feel like strong messages come in that feel outside of me, but generally it's more just this knowing, this intuition, this feeling, this sense of like, this is what needs to happen.
Exactly. Yeah. And that's what I have. Like I have this I'll just know something and I don't know where it came from, but it's very clear. And actually, I saw a patient last week who she was open because she had had an experience with another practitioner that she saw who also was a medium, but that wasn't why she was seeing them, but they told her that. And then some very important information came that basically changed her life. And when I was talking to her, information was just coming, which hasn't come in my practice in that way. And so I see that probably even aside from death with my clients, like that this will play a role if I open to it. You know what I'm saying? If I allow it.
Right. You're tapping into just another, it's like if you had a textbook and you were reading that and now you're tapping to like a whole other field of information that you can access for what's going on with them, which is so amazing.
Exactly. Yeah. Amazing and scary. And also I think one of the reasons why it's emotional and I get scared is too, because I don't want to hurt anyone,
Right. Yeah. I appreciate that.
And I think
perspective as well.
I've seen people be reckless with intuitive gifts. And I've seen that on like with my patients, they'll say something and like someone latches onto someone who has, psychic abilities or a medium. They latch onto the things that they say. And I'm very aware of the influence that I have over the people who are with me. And so I always want to be very cautious and measured about how I share things. So I'm never negatively impacting someone with information that's coming through.
Right. Right. Which is so beautiful. And really the way I think that this work should be practiced is with really clear intention and what it means to have this information. And I think that brings up a whole other podcast, which is like this notion of free will and things like that, or soul contracts, right? All of that plays into it. If you get information that someone has, I don't know, 5 months to live or whatever, is that something you're going to share with them? Is that right? Like I think this is where the ethics of this work really come into play, especially for those of us who are medical professionals with degrees and licenses that really turn their nose up at what we're talking about.
Yeah, for sure. Yeah. Well, and I think this is what's beautiful is actually, I think my experience of being an oncologist for so many years, and I've cared for over 5,000 patients, the art of using this, I was, I think, afraid of doing some of the things that I've not liked other practitioners have, I've seen happen, like recklessly use it or share the information that, like you said, could negatively impact them. But because I bring all of that experience, it's like I can use my art of the way that I care for people in discerning, what is right to share when and asking permission. And really, I very much believe in free will. And I don't ever want to step into someone else's, contract and their free will. It's like, but if it can be helpful. And I think that's where I'm just learning, like, how do you share in a way that's honoring and respecting the other person's free will and also giving them potentially some guidance that may help them in their path.
I'm just writing this down because I think one of the things that I've been toying with is bringing together practitioners in various spaces, medical, psychological, physical therapy. I mean, I've heard from all psychiatric people who are all kind of in the same boat of we're getting information that is beyond what our physical senses can know. How do we use that in a way that can be helpful?
Mm-hmm. It's a need.
Mm-hmm. Well, Katie, this was amazing. thank you so much for sharing your story, for trusting me with that story for the first time. It really is humbling, and really, I feel like one day you'll say, when I first told the story, I was on Dr. Amy Robbins' podcast. But your work really beyond this is so important and crucial as well. So if people are curious about you and your work really in terms of the oncology space, the conscious oncologist that you are, tell us where we can find everything and where we can listen to your Born to Heal podcast.
Sure. So my podcast, Born to Heal, is on Apple, Spotify, all the major outlets. And on there, I share my story of why I left Western medicine and kind of what I'm learning to help, teach others the things that I wish I had been taught in medical school about true healing. So that's my podcast.
We didn't even get into the water thing, which is a whole other podcast.
A whole other thing. Yeah.
So maybe we'll bring you back on to talk about water.
Yeah. And I think water ties into this whole intuitive thing as well. But my website is katiedeming.com, and you can find all my information there.
Katie, thank you so much.
Thank you so much. It's been my pleasure, Amy.
Like what you heard today and want to hear more? Wondering what comes next and what it all means? Head over to Apple Podcast, Spotify, Stitcher, Google Play, or anywhere you get your podcasts and hit subscribe. Also, if you could take a minute to rate and review my podcast, I would really appreciate it. Stay tuned as we continue to explore life, death, and the space between.